Hello, my name is Judy Gilkison, and I'm presenting a PowerPoint presentation on cystic fibrosis and the care plan for patients with CF. Cystic fibrosis is an inherited disorder. To date, there is no cure for cystic fibrosis, but there are promising treatments on the horizon. Cystic fibrosis primarily affects the respiratory, gastrointestinal, endocrine, and reproductive systems. The second slide is a concept map of cystic fibrosis, which shows the origins of cystic fibrosis and the body systems affected by it, as well as their signs, symptoms, and their treatments. The cause of cystic fibrosis is a mutated gene found on chromosome 7. When the gene is functioning normally, the cystic fibrosis transmembrane conductance gene affects how ions cross cell membranes, and it produces normal thin layers of gliding mucus. However, with the defective version, it produces concentrated, thick, sticky mucus. This mucus clogs the ducts and glands of the respiratory, gastrointestinal, endocrine, and reproductive systems. The respiratory system is one of the main body systems that is affected by cystic fibrosis, and it is in the lungs where the most damage occurs and more often leads to a limited lifespan and/or the need for lung transplant. Cystic fibrosis impairs the normal function of the epithelial cells that line the respiratory airways. Breathing becomes difficult due to the copious amounts of thick mucus clogging the bronchi in the lungs. The thick mucus clogs the airways, causing life-threatening infections, asthma, bronchitis, hypoxia, airway obstruction, dyspnea, bronchiectasis, and end-stage lung disease. A first line of treatment for CF respiratory symptoms is to use different categories of medications. To prevent and treat pulmonary infections, a variety of routes are used for antibiotics, such as intravenously, inhaled, nebulized, and oral. Another category is mucolytics, which thin the mucus. Then we have the traditional bronchodilators to open the airways. In addition, we have anti-inflammatory medications. Unfortunately, CF patients often have to deal with secondary disorders due to medication side effects such as renal insufficiency due to long-term use of ibuprofen and tobramycin, as well as osteoporosis due to long-term use of oral steroids. Another form of treatment for respiratory symptoms is regular moderate physical exercise and intensive chest physiotherapy. The chest physiotherapy is taught by a respiratory therapist, and it consists of teaching patients and family members positioning for posterior drainage, chest percussion or clapping, special breathing techniques, coughing exercises, and the use of vibration devices and vests. The goal of these therapies are to loosen the mucus so that it can be coughed out of the lungs. The other major systems is the gastrointestinal and endocrine systems, where the abnormally thick mucus block the pancreatic and biliary ducts, leading to pancreatic insufficiency and biliary cirrhosis. The pancreatic ducts are blocked so the pancreatic enzymes can't help break down fats, proteins, and carbohydrates. As a result, the nutrients can't be used to nourish the body. Without this, malnutrition occurs. Malabsorption, fat-soluble vitamin deficiencies, and failure to thrive are common. The other condition that occurs is the enzymes digest the pancreas and cause fibrosis, which cause cystic fibrosis-related diabetes, and patients then require insulin. Once this condition develops, there is a downward decline in pulmonary function and overall condition. In the liver, the biliary ducts become blocked, causing cirrhosis of the liver, steatorrhea, gallstones, and the possible need for a liver transplant in rare occasions. The stomach and colon are also affected by developing GERD, intestinal obstruction, chronic constipation, and chronic diarrhea. To treat the gastrointestinal and endocrine symptoms, there are a variety of medications used. For example, lactulose and polyethylene glycol treat constipation. Ursodiol treats liver disease. Proton pump inhibitors and histamine 2 blockers treat GERD. The other medications, such as pancreatic enzymes, bile salts, fat-soluble vitamins, and sodium replacements, treat the missing components needed to digest food, replace electrolytes and vitamins. And then there's insulin to treat diabetes. Cystic fibrosis also affects the reproductive system, and it affects the reproductive abilities of both genders. In the males, there is an absence of the vas deferens bilaterally, and as a result, they are infertile. In the females, thick cervical mucus prevents the sperm from reaching the ovum. However, pregnancy is still possible. The thick cervical mucus makes conceiving more challenging and may require some assistance. Females will require the use of birth control because they are still considered fertile. Due to the lack of oxygen, certain physical characteristics develop, such as digital clubbing with cyanosis of fingertips and lips. Also, being barrel-chested develops because the lungs are chronically overinflated with air, so the rib cage stays partially expanded all the time. Patients with cystic fibrosis also have stunted height and growth. The stunted growth is due to the lifelong chronic malnutrition, and the low muscle mass is due to the poor absorption of protein in the body. CF also causes adolescents to be behind in progressing through puberty due to a 1 to 2 year delay of the hypothalamus in releasing the sex hormones. This delay results in short stature and causes amenorrhea. Modifiable factors and recommended solutions. Hygiene is a modifiable factor, and it is to avoid infections by maintaining good oral, hand, and body hygiene, as well as keeping a clean house environment. Another modifiable factor would be to avoid using hot tubs and whirlpools, which would prevent exposure to bacteria. A third modifiable factor would be to aggressively address any lack of adherence with education and a multidisciplinary team approach, and provide support to address the issue and prevent any further non-adherence. To encourage CF patients to participate in social media and chat rooms to get the social support they need, so they can connect with others who personally understand what they are going through and that they are not alone. Unfortunately, cystic fibrosis patients are not able to meet in person due to the very real risk of cross-contamination of bacteria and viruses. Another modifiable factor would be in choosing a physician and to actively participate in a cystic fibrosis medical center and specialized CF team instead of choosing a family doctor or general pediatrician. In caring for CF patients, the team approach is often recommended and used with a great deal of success. Also, avoiding respiratory irritants such as smoke, dust, and allergens by wearing a mask when needed would be important. In addition, following recommended activity levels as well as diet, taking nutritional supplements, and modifying stress levels would improve outcomes. The non-modifiable factors are gender, race, ethnicity, phenotype, and genetics. For these non-modifiable factors, the solutions would be to follow a recommended comprehensive treatment plan. In regards to gender, females consistently failed worse than males in areas of bacterial colonization, lower pulmonary function numbers, and poorer nutritional status. For race, Caucasians are predominantly affected by CF. The next is ethnicity, and European and American ancestry is the most common, and Ashkenazi Jews is the second most common. For phenotype, it is how the disease is expressed and the severity and extent of the disease. The fifth non-modifiable factor is genetics. CF is an inherited autosomal recessive trait found on chromosome 7, and both parents must be a carrier. All of these factors cannot be changed, but they can be managed with a comprehensive treatment plan. The treatment plan for each cystic fibrosis patient would be individualized, but would contain key components that are needed by all cystic fibrosis patients. For example, they would need to meet with their CF team on a quarterly basis, if not more often. They would also need to use technology by wearing their AffloVest to assist with airway clearance, and participate in posterior drainage, coughing exercises, and their exercise plan. In addition, they would need to take medications as prescribed and follow their nutritional diet, avoid respiratory irritants, use technology applications in graphing FEV1 to monitor for early signs of infection, stay well hydrated, and monitor for the beginning of bowel obstructions and treat promptly. The treatment plan would also be based on where the patient was in the stage of their illness. For example, if their respiratory function was in end-stage lung disease, they would need humidified air, oxygen therapy, hospice care, and possibly preparation for lung transplant. However, if they were not at this stage, then these factors would not need to be part of their current treatment plan. This is an example of a nursing care plan for a cystic fibrosis patient. Primary care intervention plan goals would be to prevent the occurrence of the disease. Interventions would include providing education and providing preconception genetic counseling. And if both individuals were carriers of the CF gene, then conception would be avoided and their options would be discussed. Secondary care intervention goals are to minimize the effects of cystic fibrosis. It also includes diagnostic screening and testing and obtaining a thorough health and family history. In addition, other interventions would be to take prescribe medications, perform chest physiotherapy, follow nutritional plan, stay well hydrated, and follow exercise plan. Tertiary care intervention goals are to focus on the treatment of cystic fibrosis and to lessen its effects and to prevent further deterioration through the use of counseling, support groups, and rehabilitation. There is also health teaching related to dealing with the complications of cystic fibrosis and to enhance the quality of life. In conclusion, CF is an autosomal recessive multi-system disorder that affects mostly Caucasians. It is estimated that 30,000 Americans and approximately 70,000 people worldwide are afflicted with cystic fibrosis. There is no cure for cystic fibrosis. The best medicine can do is try to prevent infections and treat the symptoms. Females are now living in their 40s and males are living in their 50s. There is hope on the horizon for new and curative therapies. The goal is to help patients live with cystic fibrosis with quality and live a longer life. Thank you, and please review the references at the end. Thank you.